I just want to pick up on something that my colleague asked earlier around the scale of issue and how it relates to the wider hospital system. So, do you think that the maternity issues you've identified, by and large, are reflected in the hospitals in which they sit? And I suppose, to look at it another way, is it possible to find an exemplary maternity unit in a failing hospital?
I will let you answer that one.
That's a brilliant question. I personally work in an outstanding unit within a trust that some of its services are outstanding, some of its services are good, some of its services have challenges. We do know that when we talk about leadership, we mean the leadership at the top. So that is at trust level. And what we found when we visited across the 12 units is that where there was poor leadership, we often found trusts, maternity services that were struggling. And conversely, where we had strong leadership and leadership that understood and had buy-in into maternity services, we had strong maternity services. From my point of view, it's always interesting to look at services that are outstanding and understand why they are outstanding. Are they outstanding because the maternity system nationally allows that, or are they outstanding in spite of? And what we found was that there was this inconsistency in care that is maternity care that's delivered across the country. So that means that outstanding services occur in spite of the system. So therefore, our report and our recommendations is to standardize high quality maternity and neonatal care for everybody every single time. And that would mean, as part of that, to strengthen poor leadership all the way. So from the service delivery leaders all the way to trust leadership, such that we can then see improvement in our maternity services.
Thanks, that's really interesting. So,
can I just add one thing to that really quickly? Because one of the things that we say in our report is that you need a national framework that helps trust to implement. And we haven't got that at the moment. So if you're a trust and you haven't had an investigation, you get handed a whole set of recommendations. They are not necessarily shared they're not necessarily shared nationally, and you don't necessarily get support to help you to implement. So that national repository is also important.
Sure. So just following on a bit from that, in your review, Baroness Amos, are there any areas that you would have liked to have covered in greater detail that you weren't able to? You said you saw a lot of things in a very short space of time. Are there any areas where you think, actually, I would have liked to have looked at that in more detail?
There are areas where I think that there is disappointment that we were not able to go into those areas in more detail. So, for example, there were a number of campaigning groups around specialised medical conditions that we were not able to go into in detail. The whole area of maternal mental health is an area that needs urgent attention, and we have recommended to the task force that they need to look at this. And wider inequalities. I mean, our report talks about racism and equality. We are very strong, I think, on the issues around racism and discrimination. We talked to representatives of a lot of organisations, including refugee organisations, Roma and Traveller, Muslim and Jewish communities, LGBTQ+. There is so much in the area of inequality that needs to be addressed, and this urgently needs to be tackled. And linked to that, deprivation more generally. And again, in our report, we talk about the importance of linking up what is happening in maternal and neonatal care with what is happening in public health, and what happens, even before a woman or birthing person becomes pregnant. We were not able to go into the level of detail that we would have liked to, but all of these have huge impact on what is happening in maternal and neonatal care.
So, you obviously talk to a wide range of groups, both public stakeholders and hospital trusts. Can I ask, what has been the reaction to your report, both for the groups that you talked to and perhaps for some of the groups that you didn't talk to?
The reaction has been mixed. We anticipated that. When we started, for example, there were a group of families who spoke to me right at the beginning and said, we don't think that your report is going to deliver anything that we are looking for, because what we want is a statutory public inquiry, and they were very open and honest about that from the outset. For example, there are campaigning and advocacy organisations that hoped that we would go into more detail on some of the issues that they are concerned about, and we were not able to do that. There has been criticism of the report with respect to what we said on normal birth ideology, for example, where we did not want to dismiss the concerns of families who shared personal experiences of the findings from previous investigations, but where from our investigation we were not able to find evidence of a national prevalence of normal birth ideology. We didn't say that it didn't exist, but we were not able to find the evidence of that, despite a specific question in the call for evidence, despite all the interviews we did, both with people in the workforce and also with families. I know that was a criticism. There's been criticism from harmed and bereaved families that despite the fact that we wanted to take a families first approach and wanted to be trauma informed, that there is not enough in our report that speaks to that experience, and there's been quite a lot of criticism of that too.
And you sort of talked a little bit about your response to some of that criticism. Do you accept any of the criticism, and have you had time to reflect on, no review is perfect, have you had time to reflect on some of that criticism and how, you perhaps would think slightly differently based on the response?
Yes, we have reflected on that criticism. I think it is absolutely fair to say that we have not recommended a statutory public inquiry. The view of the investigation from the outset has been that that's for the Secretary of State and for the government. It was not for us to determine. I think within the context of our terms of reference and what we were able to look at in terms of normal birth ideology, I think that what we have said in our report reflects the evidence that we saw and heard. It's a nuanced position, and I absolutely accept that, and I totally understand that if this has been your experience, the fact that we as an investigation team were not able to go further than we did would have been a significant disappointment.
And do you support the calls for a public inquiry?
So I have a personal view. I do not speak for the investigation. The families that have spoken to me have specifically talked about, for example, issues around accountability, which I think our report, if implemented, will help to address. Have talked about the importance of individuals being compelled to give evidence. I think that some of that will be addressed through the new Hillsborough law, for example. So I do not, but it's my personal view, and I have not been through the traumatic and difficult experiences that those families have. So in many ways, my view doesn't really count.
And finally, I just want to ask around the interplay, the overlap, the tension between your review and the reviews that Donna Ockenden is undertaking. And obviously we will hear from Miss Ockenden next, but I represent a constituency in Sussex, and there will be an Ockenden review in Sussex. And I speak to University Hospital Sussex very regularly. Obviously they have now had your review. They've got over 100 recommendations, both from your review and from looking at the Nottingham report. Do you think that what do you think? Do you think that these reviews are complementary? Do you think that trusts like myself, in Sussex, where we have an awful lot of pressure, there's an awful lot of other stuff going on, having over 100 recommendations from both of these reports, do you think that in and of itself could be problematic, or that actually these recommendations are complementary and will allow trusts like Sussex, one, for the Sussex families to get the review that they've requested, but also to move forward with maternity units where the staff are clearly working very hard? How do you feel about both those reviews?
I think there's a huge amount of overlap in terms of the issues identified by the different reviews. In fact, one of the things that many people have said to us is, but you haven't said anything different. I don't actually accept that, because I do think the points we make around safety critical issues and so on, the national scope of what we did, looking at systems, is very different to case reviews in individual trusts. But there is a huge amount of commonality in terms of what all of those reviews have found. In our review of previous recommendations, and we very much did not want to add lots and lots and lots of recommendations on top of that. One of the things that we have said is that these recommendations need to be looked at nationally, and they need to be prioritised, because what you can't have 700 recommendations going to trusts, and trusts not knowing what is more important than that. Where are the resources to do this? So there has to be national oversight of this, and I hope that what comes out of the task force in December, in terms of the action plan, will have a degree of prioritisation in that.
Great, thank you. Paula Hamilton.